All right, so we're going to get started now with continuing with ethics. So the last part of the course, we started off with history. Now, as we progress, this is nursing history and ethics. So we're going to be focusing on ethics in the last handful of lectures that are left. So, all right, when we look over here, so they talk about the meaning and scope of nursing. So again, from very early on, from the early years, nursing professionals, they constructed the meaning of nursing around the concept of ethics and ethical ways of for caring, uh, for acting, and for knowing. Um, so it's believed that bioethics it came about to be between 1947 and during the period of 19 so in the 70s between 19 in the late 40s to the early mid 70s. Um, Up until this point, nurses they were in terms concerning ethics. Why? Because again, at this point, bioethics decisions they were mainly made among doctors, philosophers, and theologians. So when you look at what's going on today in present day nursing, today all nurses, at least in the West, in the UK, in the United States, in other parts of Europe, uh, in these regions, nurses, they're able to engage in the ethical decision making and behaviors that come from morality, relationships, in addition to conduct issues that involve patient care. And in addition to that, uh, they also partake in discussions involving ethics that deal with relationships with one another and other healthcare workers. So again, nurse to nurse, nurse to doctor, nurse to physical therapy, or again, it could go anywhere around a physical therapist with a nurse or a nutritionist with a physician. In the entire ethical process, nurses are also involved. They have a voice now. They are heard. Put it this way. So again, when you look at that again, in terms of right, so professional codes, right? So these professional ethical codes essentially they serve as a tool. They're useful. Uh, they end up making a systemic, a normative guide, right? So again, they provide guidelines as to what would be normal uh, for both and to provide direction as well as shaping behavior within the profession. So when you look at the American Nurses Association Code of Ethics, right? What is all this about? So they outline nine non-negotiable provisions, and each of them, each one of these provisions, they have they have they made interpretive statements for drawing a picture of what the narratives for ethical decision making would be in a clinical practice, also in education, in research, in administration, and also even for self-development. They went that far. So again, it requires nurses to be um, attentive and loyal to every patient that they deal with in their caretaking. It requires them to be cognizant of ethical issues, in addition to conflicts that may arise. It could be a conflict of interest that negative effect on patient relationship in addition to patient care. The wholeness of character that relates to nurses. Uh, so, we're talking about professional relationships with patients and also recognizing values within the nursing profession. Trying to understand and integrating these belief systems and also to express them properly. When the personal integrity of nurses, it involves, again, nurses to put out, they have to put out attention and care to their own needs. Okay, it's yes, all right, fine, what you have to do with the patients, what you're supposed to be doing with the patients, but also what do you need in order to do that? So again, what is ethical in terms of the needs of nursing? Also, this is also addressed, and again, they have codes for that. So when you look at the ICN Code of Ethics for Nurses, again, first of all, ICN stands for International Council of Nurses. Okay? The International Council of Nurses. So again, they have Code of Ethics as well. And this, it ends up forming a framework to guide, again, as we saw earlier on, in the other examples that we looked at, this also ends up making a framework to guide nurses, to guide nursing conduct in their practice, in their education, in their research, as well as in their leadership. All right, so what are some of the common threads between the ANA and the ICN codes? So they share values such as respect, privacy, equality, in addition to advocacy. So again, they believe that the nurses, they should protect the moral space in which the patients receive their care. So again, protecting the moral space of patients, it it requires nurses to provide compassion, okay? Compassionate patient care. And again, the aim of this compassionate patient care is to remove suffering of the patients. So both the ANA and the ICN codes, they apply to all nurses, regardless of their role. Now, although there's no single code can provide all the answers to every situation. The codes, they serve as a mandate, right, for accountability in practice. And again, what they end up doing is that they establish professional boundaries. So these professional boundaries, they're limits that protect the space between the nurse's professional powers and the patient's vulnerability. So this is extremely important. Remember, when you're a patient, and again, you're on a bed, you may have come out of a surgery, or you have some type of an illness, you feel in a very weak position, right? You don't feel that you have control. And pretty much, again, some people, they tend to abuse this. So with that, this is another reason why they end up having these ethical codes that all nurses, all healthcare professionals for that matter, they have to abide by. The quality and the wholeness of character, when you're looking at nursing ethics, hold on 1 second, it's not advancing. There we go. All right, so when you look at moral integrity, both both the quality as well as the entire character, it's made up of what? When you look at nursing, first of all, again, you have to be truthful, right? You have to be honest, truth telling. You have to have some moral, again, you have to have moral courage, moral integrity. Wisdom also is needed, and benevolence. All these things are extremely important to have. And again, this is what's going to reinforce moral integrity. So again, moral integrity it entails all these points that I mentioned. Again, this is what completes, what makes part, it's incomplete, but this would be the bare minimum that needs to be present for healthcare professionals, especially nurses. Again, what are they? Again, you have to be honest. You have to tell the truth. So again, there's truthfulness, and you have to tell. So not only you need to be truthful with what you know, what you understand, but also when you give that information, you have to tell the truth as well. In other words, you can't hide the patient from the truth. You may think that you're doing them a favor because you don't want them to worry. So that's, again, that would be unethical. So again, both truthfulness as well as truth telling, they go hand in hand together. You can't do one without the other. Benevolence, wisdom, moral courage. So again, when you look at honesty, right? So honesty, essentially, it's gonna equip people, it's gonna equip nurses with the ability to place an emphasis on action and resolve in order to achieve justice, okay, within the setting that they're working in. So again, it's a well thought out and well rehearsed behavior that reflects commitment and as well as integrity. So when you look at truthfulness and truth telling, so truthfulness, again, this is being genuine, okay, in all your words, as well as what you do. So both your deeds and your words, they have to align. Okay? It has to be genuine. Truthfulness, again, think of that as meaning, think that as being meaning that healthcare professionals, nurses, they're usually ethically obligated to tell the truth. And they cannot intentionally deceive patients. So again, you can't keep information or misinform your patients, even if you think that it's for the better. You may think that you're trying to protect them, but again, it's wrong. It would be unethical. So moving on to benevolence. All right, benevolence, again, this is the propensity and desire to act to benefit other people. Okay. Right. You have to have a genuine drive, a genuine desire to go and make a positive impact in other people's lives in any capacity for that matter. So again, when you look at wisdom essentially, we're talking about wisdom would require precise, calculated intellectual ability, okay, contemplation, deliberation, and any other efforts to achieve some type of a worthy goal. Okay, so that's what this is what wisdom would encompass. When we move on to moral courage, what are we talking about? So we're talking about standing up or acting upon ethical principles in order to do what is right, even when whatever you may be doing could constrain or maybe perhaps force you to do something else. So you have to go out of your comfort zone. That's what they're trying to say over here. All right. In terms of communications, again, we've talked about this in the past. This is very important. And again, what is the goal of communication? It's primarily, again, it's to exchange information, right? It's the exchange of information. And this could be done through many, many, many ways. Again, it could be done verbally, through messaging, through sign language, again, through body actions. All these are forms of communication, right? Where an exchange of information is taking place. So again, this communication, it should be done in a meaningful manner, right? It should be very clearly understood between the parties that are involved or that are partaking within that conversation. So not only does communication require effective speaking and an effective um, form of using your words for that message to be clear, okay, and delivering it clearly. Not only is that required, but communication, again, effective communication, it also requires mindful and effective listening as well. Okay, so it works both ways. It's not a one-way streak. The patient is talking and telling you everything honestly, truthfully, and meaningfully and clearly, but the doctor, the nurse, the healthcare professional for that matter, they need to be effectively listening as well for that communication to be successful. Okay, and also to keep future communications successful as well. Because if you don't, then what ends up happening is you end up breaking the chain of communication. So, if you snap at a patient, they're not going to come to you with their issues anymore. They'll be afraid to come to you. So you have to keep that in mind. You want to give. So again, this is why they're saying there has to be boundaries. Yes, you could be compassionate, caring, loving to your patient, but again, it should not be in a way where the boundaries are confused. Okay, there needs to be a patient uh, practitioner divide, to put it mildly. Okay, there has to be a barrier between the two. When we're talking about mindfulness, so mindfulness, again, they're talking about being engaged and attentive to activities that are being done or roles that are being occupied. And this has to be continuous. Okay, so you have to continually analyze. You have to continually uh, be able to categorize different things, and also you need to be able to separate all that information that's coming in. Okay, this is what mindfulness is: categorizing, analyzing, and being able to understand what the data is, what the data means, and how to apply it. Not apply it, but what it means. So again, you have to be able to distinguish that data. You should be constantly, continuously analyzing it, and as more and more information comes in, you need to start categorizing it, because patients will tell you a lot. So moving on with effective listening, again, as I said before, you have to be attentive when you're receiving the information. So uh, there needs to be, for effective listening to take place, the end goal is that um, a mutual understanding of that meaning of what you heard needs to be done. Okay, so there needs to be a mutual understanding and yeah, a mutual understanding of the meaning of the dialogue that took place between those that are involved in that communications. And again, when that happens, both of the communicators, they're able to understand that active information. In terms of concerns, so when nurses, they feel a sense of responsibility to think about the scope of care that's important for their patients, it's going to involve you're going to need to be your patient's advocate. You have to empower your patient, and not only do you need to be not only do you have to be their advocates and empower them, At the same time, again, we're living in a multicultural society, so you have to be culturally sensitive as well. You have to them. When it comes to advocacy, there's three central characteristics that form this. So what are these three essential characteristics? One is safeguarding the patient's autonomy, right? Safeguarding the patient's autonomy. That's the first thing. Next is, again, acting. You're the advocate for that patient, right? So not only are you safeguarding their autonomy, but also you have to act on behalf of that patient as well. Okay, you have to be their voice. That's what that means, acting on behalf of that patient. Also, again, you have to be a fighter, right, for social justice. Okay, within the healthcare system. Everybody, look, healthcare should not be a privilege. Okay, it shouldn't be a privilege, but again, it's a necessity. It's a basic right that everybody should have. So when you look at that, when you look at this word power, within this ethical context, we're talking about, it could be a single person, could be the nurse, could be a doctor, or again, it could be a group as well, a group of physical therapists, a group of nurses. Okay, these either individual or these group, they have influence in effective matters over others. Okay, so they hold influence in effective ways over other people. All right, that's what power would be. What about cultural sensitivity? It's pretty obvious, but again, when you're adapting to caring for a person, that's in a manner that would be consistent with the culture of your patient. This is what we would say is being culturally sensitive. Okay, so again, this needs to be cultural sensitivity. It needs to be a conscious process. It should not be it should not be linear. All right. So again, it has to be a conscious process. You have to know what you're doing. You have to know what you're saying, and you have to know what you're understanding as well. So again, it's a non-linear process. Okay? It's this conscious processing. So one of the risks that are around is risk of crossing professional boundaries. So I kind of mentioned it earlier. When the lines of these these walls of the moral space, they start to become blurred, then again the risk of crossing the professional boundary, it starts to go up significantly. So these blurred lines of blurred line behaviors, and again, obvious points when line crossing has occurred, they involve invasions of, you think of it as an invasion of moral space. Okay? And also, again, it could be a violation of privacy, depending on. So you have to be mindful of that. So these are some of the dangers that are involved within social media. So you cannot start talking about your patients. That's not allowed, right? You can't post things about what happened in your day. Again, not only is this for nurses, but also for or physical therapists or an occupational therapist, or it's for all healthcare professionals. But so for nurses at least, since this is a nursing course, nursing class, nurses and nursing students, both nursing students as well, they have to remain devoted to respecting humans in general, people in general, in all your interactions. And again, this goes and it extends, not only is it face-to-face, but it also extends to electronic forms as well. So again, there's social networking. So social media is. So can social media be used in a positive manner within the healthcare system? The answer is absolutely, right? And one of the things that social media does is, it gives you up to date, minute by minute information, right? The other points that it ends up being used, for example, now for answering questions as well. Again, you can share a lot of information through social media or even through websites. So one thing is, again, mind you, you have to know how credible, how knowledgeable that person is that you're getting that information from. Okay, this is very important. Because again, this could end up causing problems in terms of how useful, how valuable that information that you receive is. Um, so negative use of social media in healthcare. So questions of, and as I said before, confidentiality and privacy. Right? These pose the both ethical as well as legal problems. Why, again, you can't post things about, oh, my patient had this, my patient had that, or, guess what, I have a very famous patient that I'm taking care of. You can't post things like that in social media. Again, there has to be patient privacy. It's extremely important for that to take place. Yeah. So keep posting appropriate material. That's one of the things you can do as a strategy for positive strategies in utilizing social media. And also, again, you have to be mindful of what you're saying. Don't just post things, when you're in a rush or, when you're doing a lot of other things. You have to know consciously post useful, positive information. Always maintain respect. You're the healthcare professional. Again, somebody says something that may be disrespectful, don't start yelling and screaming and call them, all the names from one end of the planet to the other end of the planet. But again, as a nurse, again, you have to remain quiet, and you have to listen to what they're saying. Most of the time, people just want to be heard about their concerns. That's it. The vast majority of the time, they want to be included in their care process, and again, they want that knowledge as well. So they're seeking information, a lot of information, and again, it's the duty of the nurse to relay that information. Okay, so all right, so that is this week's lecture, right? That's all there is for that. Make sure you're taking good notes. Make sure you're writing everything down, and I'll end up posting this. I'm not sure when, but I'll do that as soon as possible. As soon as I can, I'll have all that information up on a site. I'll put a link probably. Questions? Who's got questions? Nope. No questions?